Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Stephanie Faubion. Welcome. Tell everybody, all our women who are listening, who you are.
Thank you. Well, I'm medical director of the North American Menopause Society, and I also am the chair of the Department of Medicine at Mayo Clinic in Jacksonville, Florida.
So women are getting more educated every day about menopause, menopausal symptoms, the impact on heart, bone, and typically we've always talked about estrogen and estrogen therapy for women, and the types of estrogen that have been around now for decades, but new horizons opening up in the treatment of menopause. What's new and exciting?
Exactly. Well, it is exciting because, as you're aware, we haven't had new drugs on the market for menopause in quite some time, and the original estrogens came on the market in the 1940s. So there's a new estrogen out there now. It's called estetrol, or E4. And just to remind everyone, what our ovaries used to make was E2. So this is a little bit different. And the exciting part of it is it seems to behave in a different way than the typical estrogen that we used to make before menopause. And there may be some benefits to this compared to estradiol. So it may have a more favorable effect on the breast. And it may have less of a clot impact. Studies are still ongoing there, really, to compare this to more standard estrogens, however. But this is available already in a birth control pill, and it's being investigated for a postmenopausal therapy for hot flashes.
So I think it's important for women to understand that when we talk about the class of estrogen, not all estrogens are the same. So not all estrogen molecules or the way that you deliver it, if it's a gel or a cream or oral,
Right.
it really, and this is a brand new estrogen that's innate to our body though. This is not an estrogen that's completely synthetic per se.
No, it's not synthetic, and you're exactly right. I talk about this often, how we can't clump all hormone therapy into one bucket together, and estrogens are different and behave differently in the body. So this one is unique. It's produced by the fetal liver, and so it is naturally made. Not by women per se, but it is a natural estrogen, and so it is another option that we may have, and it may have some different safety properties that will be very interesting to see going forward.
So stay tuned. Interesting.
Yes.
And now into the realm of something completely brand new that's not estrogen at all.
Right.
When it comes to the most bothersome symptoms for most women, hot flashes, night sweats. What's new there?
Well, there's a new compound out there. These are the NK3 inhibitors, and while that's a mouthful, they seem to be targeted towards some neurons in the brain. And so we think hot flashes come from an area in the brain called the hypothalamus. And this chemical compound specifically targets some neurons in the brain that we think produce hot flashes. And so studies are coming out now, and they're ongoing, looking at the effectiveness of these chemical compounds for hot flashes, and they are remarkably effective at reducing hot flashes within about 48 hours. So very, very exciting, but the thing that we don't know is it works on hot flashes, but does it work on some of the other things that women are concerned about around this time frame, like vaginal dryness or loss of bone density?
Certainly contributing to the science of where a hot flash originates. Women can tell you what it feels like and how long they last and how frequent or how severe, but often we don't exactly know why and why they're so variable in some women compared to others, why some women seem to do this forever and other women, aren't bothered all that much.
Right. It is such a unique experience. And as you say, we don't know why this is a non-event for some women and they literally never have a hot flash, or why some women are bothered well into their 70s and 80s. And I know you see women like that too, who are like, dear God, when are they going to stop, right?
Yeah, is it going to be never?
Yes. But this is, I think, exciting because it's a new chemical compound that we will have in our armamentarium that gives women some choices about what they use.
So exciting days ahead for women just in terms of the fact that there's ongoing research, ongoing education. We care about you and your hot flashes, and stay tuned to see where we go next.
Exactly. Thank you.
Thank you.